Bismillahirrahmanirrahim and Assalamu alaikum students. I hope you're doing well and taking great care of yourself during COVID-19 crisis. Welcome to online classes as well. I hope that these online classes save a lot of your precious time till the things get back to normal. Um, for online classes, the very first chapter that I selected is bioavailability and bioequivalence. In this chapter, we will get introduced to the concept of bioavailability. Then we will proceed towards the bioequivalence concept. Then we will try to understand the interrelationship of these two concepts and how significant these studies are during the drug development process, means in the research. Okay, so as I just mentioned that the very first chapter is of bioavailability and bioequivalence. So the topic which we're going to discuss today in this lecture is Introduction to Bioavailability, its significance and objectives. Discussion agenda for today's lecture means the things which we're going to cover in this lecture are introduction to bioavailability concept, then various definition which may be used to explain or understand the concept of bioavailability. Then we will get introduced to bioavailable fraction terminology. Then we will discuss the objectives of bioavailability studies and of course then its significance. Let's now briefly discuss about the historical significance of conducting bioavailability studies on drug formulations before their market appearance. Till 70s, it was never considered important to make the bioavailability studies part of formulation development process, or you can say that it was not considered mandatory at least. But as we know that different drugs got different therapeutic indices levels, so the drug with narrow therapeutic index will soon cross the toxic or minimum toxic concentration, as happened in Australia in the year 1968, that phenytoin which was being administered to various epileptic patients in a certain dose, the patients started to experience toxic effects. So at that time, it was felt that it's extremely important to conduct the bioavailability studies. Otherwise, within no time, the patients might experience toxic effects if the situation is doesn't get clear. Similar situation happened in 1971 when. In that year, the different formulations of digoxin coming into the market was providing actually the product with different levels of bioavailabilities. Now, this was another alarming sign, definitely. So, what is the proper definition of bioavailability? According to Goodman and Gilman, bioavailability is a term used to indicate the fractional extent to which a dose of drug reaches its site of action, or a biological fluid from which the drug has access to its site of action. Then, according to another definition for bioavailability, the term bioavailability is defined as a rate and extent. In other words, amount of absorption of unchanged drug, or in simple words, the amount of the drug from its dosage form or from the site of absorption, it means. Okay, you can see that there are two components to the bioavailability. One is the rate of absorption, and the second one is the extent of absorption. Rate of absorption becomes important in case of acute conditions when it is very important for a drug to reach as fastly as possible at the site of action. And basically, the rate of absorption is the rapidity with which a drug gets absorbed. Then there is extent of absorption, or those conditions are there when uh, for drug it is important to reach in certain concentration, like certain chronic conditions like epilepsy or hypertension and etc. Okay, to look into the matter that what could be the possible objectives behind bioavailability studies, there are few points which are important to understand. Number one is that during primary stages of development of suitable dosage form of new drug entity, as you know, that before a new drug comes into the market, so during the development of new dosage form, different tests and studies are performed, including bioavailability studies. These studies are also useful to see the influence of excipients and select the most suitable one for the final dosage form. And apart from that, bioavailability studies are equally important when it is experimented that how the product might perform under various patient-related factors, or similarly when co-administered with other drugs, how the efficiency of the absorption can be affected. Similarly, when the existing drugs are converted to other formulations or some changes are brought about in their existing formulas, still bioavailability studies illustrate a lot about the final absorption efficiency for the product. Bioavailability studies are extremely important for the drugs which have low therapeutic indices. For example, cardiac glycoside, digoxin is one of the best example, or quinidine or phenytoin, etc. Similarly, those drugs which have very narrow margin of safety along with low therapeutic index, for such drugs, as soon as they cross the minimum toxic concentration, the patients start to experience toxic effects. For example, many antiarrhythmic medications or theophylline or anti-diabetic medications. The drugs whose peak levels are required for the effects of drugs, and those also need to be maintained at that level for prolonged period of time. For example, phenytoin, phenobarbital, and sodium valproate, the drugs which are used for the patients of epilepsy, and actually these are used on such peak levels and for prolonged period of time in order to prevent seizures it attacks from happening. So peak levels should be maintained for a longer period of time. This situation is also required in case of certain hypertensive or diabetic conditions as well, or antibiotics which are being used to eradicate the infection properly. Um, Similarly, the drugs which are absorbed by active transport, for such drugs also the bioavailability studies are highly significant to be conducted, because such drugs are substrates for certain transporters which are dependent for their active transport upon certain transporters. However, these transporters are shared with other drugs as well, and this competition results in or this is a competition situation which results in their saturation, and the saturation of the transporters. So that's why in such situation the toxic effects can be witnessed in the patients. So bioavailability studies are highly significant for such drugs to get conducted in order to assess the situation fully. Okay, bioavailability studies are extremely significant to be conducted in case of the drugs which are disintegrated in the alimentary canal. As we know that the drugs which are orally administered are subjected to disintegration in the alimentary canal, or they could go extensive first pass metabolism, and one of the example is of fluorpromazine. Now this drug is an antipsychotic medication which is used for the patients of schizophrenia, and we discussed earlier that such antipsychotic medications are required to maintain their peak levels for a prolonged period of time, and so in such a sensitive situation, if these are being used and they are subjected to, in parallel to that they are subjected to metabolism, first pass metabolism, or the disintegration in the alimentary canal as well, then definitely their levels could get compromised. The required levels at the site of action could get compromised in such a situation. And to conduct the bioavailability studies for such formulations to make it sure that these formulations are able to provide the required amount of the drug at site of action becomes extremely significant. Similarly, there are formulations that claim to provide or deliver sustained release of the drug, and For such drugs to conduct bioavailability studies becomes important because such drugs require to provide a certain concentration of drug for a certain prolonged period of time. So whatever they are claiming, if they are not able to do or able to do that, that is only possible to confirm through the bioavailability studies, because in such cases, or in the case of such formulations, it is extremely common that, despite the fact that they are claiming that these are sustained release of the drugs, but instead of that, what happens that there is dampening effect, means there is a phase when load, or the drugs release too much, and then there is a phase when drug stop to get released. So through bioavailability studies, it should be made sure that drug is releasing at a constant pace, as the formulation claims. Okay, students, so this was for now for this lecture, and in the upcoming lecture, we would be discussing about other topics related to bioavailability, which are supposed to be covered under this chapter, inshallah.